And last step here. All right, great. All right, well, thanks again, everybody, for joining us today. This is our final Healthy Rural Oregon Network Partner Call of the year. So today, just a couple of reminders. Those of you who've been on this call before have seen this before. If you are new or want to reintroduce yourself, please go ahead and drop your name and your role or organization in the chat to introduce yourself. As I mentioned previously, this meeting is being recorded so that those folks who weren't able to join us can catch up on what we're doing with this project and the things we have on the agenda today. It will be posted on CLO's YouTube website, and we will share the link to that after the meeting, along with the minutes. If you're not speaking, please mute your microphone just so we don't get background noise. We've got a good number of people on the call, but please feel free to raise your hand or add any questions or comments to the chat. I think any of us are happy to pause and continue discussion as we go through today. So today we're going to start off kind of in a similar format to what we usually do. I'll give a few project updates on Healthy Rural Oregon and what we're doing and how things are going. And then I'll have an open call for anybody here who wants to give an update about what their organization specifically is doing. I know we've been working with a lot of you on different trainings or updates or just looking at the future post this grant. But I would love for you all to talk about those things within your organization to give us a little bit more of an update about what you all are doing in your neck of the woods as well. And then today we have Sarah Lochner, who's the executive director for CLO, on the call with us. She's going to talk a little bit about this upcoming long session with the Oregon legislature, talk a little bit about what CLO has their eyes on as far as legislative priorities and ways that you all can engage with the legislature, despite maybe having different restrictions for different organizational types or just not maybe understanding the best way to engage with different priorities. So Sarah is an absolute pro at this kind of thing. And so I was super happy that she was able to come talk about this today. So, all right, with that, so kicking off just a little bit about our project updates. So as many of you already know, this grant that funds the Healthy Rural Oregon project is on a 3-year cycle. It started back in 2022 and it is set to expire June 31st of 2025. We already know this grant is not going to get extended, although HRSA, the Health Resource Service Administration, who is the primary funder of this grant, has said that there's a lot of interest in this kind of work and is looking at other ways to continue opening up additional grant opportunities that meet some of these things. So keep an eye out in future newsletters that we send out or communications for new grant opportunities coming from HRSA or the Office of Rural Health Policy, because like I said, there's a lot of opportunity coming up for this, even though this specific grant we're working on is not going to get renewed. So with that background in mind, we do still have scholarships available for a few particular training types. Particularly, we're looking at community health worker certification, EMT training, both basic and intermediate, paramedicine training, and then community paramedicine or mobile integrated health related trainings. At this point, we have good money left in these pots. So if you or someone in your organization is interested in any of these types of trainings, please reach out to us. We can almost certainly get you into a training in the next couple months, as long as you meet our rural criteria. For all of the other types of trainings that we have been sponsoring or working with folks on, we are down to kind of a case-by-case basis review period for this. And that's simply to ensure that we don't overspend our grant dollars as we're getting into these last few months, but also so that we're prioritizing folks that we haven't served maybe as much as we would have liked through this grant period. So that looks like folks in rural communities that we haven't had any trainees in or have had very few trainees in, individuals who speak a language other than English, and those who are from other underserved or underrepresented communities. Again, really just trying to boost those folks that haven't had access to or who we haven't engaged with yet. So if you have someone or either a training or a trainee who may be interested in a scholarship, please don't hesitate to reach out to Janessa and I. we will put them on our kind of wait list, which we review every week, and go through the budget and make sure that we have training dollars available for the particular types of trainees that folks are looking at. And then we'll get back. We just don't have kind of a bulk review process at this point, just because we're getting towards the end of our grant cycle. The other thing I just want to mention, and it's in that green box on my slide there, is that because our program ends in July of 2025, our scholarship funds have to be distributed prior to this date. So if somebody is, say, in a paramedicine program, which many times can take a full year, we understand that that program may not be finished by July 31st of 2025. However, if we are able to pay for the entire program prior to this date and the student has started and engaged in the program, that is totally fine. Or we can pay for part of the program as much as we can prior to that July 2025. So if the program is extending beyond that time, that's fine. The student doesn't have to be finished with the program by July. However, we do have to have all of those funds distributed prior to that time. So that's just something to keep in mind as we're looking at the timing of some of these trainings and scholarship distribution. And keep in mind that the later we go and the closer to that date, the more and more restrictive we're going to have to be in distributing scholarship funds for these trainings. So if you think that you're going to want to get you or some of your team members in for some of these trainings, please do so sooner rather than later, because as we really get into the spring, we're going to be redistributing our funds into ways that we can spend them before this July of 2025. So we don't have any dollars left on the table.
Hey, Madison, can I jump in real quick?
Absolutely, you can, Janessa.
So I was just going to say too that, we're really, as Madison said, we're kind of trying to be really thoughtful about where we're spending these monies. And so please, if you have folks who are like second language speakers or represent communities that are really underserved, and however you define community, right, whether that's culturally, linguistically, right, we really want to connect with folks that we haven't yet or that haven't yet benefited from the scholarships or from the funding. And so, please feel free to send folks our directions too that really kind of meet those criteria, because we're definitely putting a little bit more weight on some of those like requirements, whatever criteria. Thank you. That's what I'm looking for. All right,
perfect.
Thanks,
Janessa.
Thanks.
Yep. So another thing that I wanted to officially get to announce is that in partnership with Neon, we this fall put together an application for HEC Higher Education Coordinating Commission's Future Ready Oregon grant cycle. And our proposal with Neon, which was put together in collaboration with them, CLO, us, Bridges to Health, and Mid-Willamette Valley Community Action Agency, was awarded. So we will have it actually with a retroactive award. So it started back in September and will go through June. So actually maybe it retroactively goes through July of this year through June of 2026. And we have about $350,000 from that grant, which we'll be using to start up what we've dubbed the CHW Training Hub. Neon, as the primary awardee for this, will be kind of serving as that CHW Training Hub. And then working with Bridges to Health and Mid-Willamette Valley are going to be standing up a program where these kind of satellite organizations are able to have CHW trainers that work under Neon's licensure, their expertise with their curriculum, their platform, their QA, QC, and really stand up more community-specific CHW trainings in their communities. So Bridges to Health is located in the Columbia River Gorge area, and Mid-Willamette Valley, as dubbed by their name, is kind of in the western, just west of the Cascades area in Oregon. So this is a really exciting opportunity because it really aligns with the priorities of the Healthy Rural Oregon grant and will provide a good way forward after the end of this grant to continue a lot of that training, accessibility work, and workforce development work that we've been doing, particularly focusing on rural, BIPOC, and other underserved communities. We know that there's a lot of areas in the state that are lacking access to adequate CHW training, or even further CHW supervisor training, or ways for CHWs to advance in their careers. And this CHW training hub will really allow for expanded reach and expanded kind of training content for community health workers. So we're really excited about this program and are hoping to continue expanding it beyond just this grant period. We're excited about this grant because it'll really give NEON and those partner organizations a boost to be able to get this off the ground. CLO's role in this grant will be continuing to do what Janessa and I have done with Healthy Rural Oregon. So providing scholarships and wraparound barrier removal funding for trainees in these various community health worker programs. So again, a really nice kind of sustainability piece from our current grant into this next one. And then lastly, I just wanted to touch on a few legislative concepts that we have our eyes on and have been working with folks as they progress towards the legislative session. Like I mentioned, Sarah's going to talk a little bit more about the legislative session later on in the call. But these three are really directly related or closely related to what the Healthy Rural Oregon program has been trying to do over the last several years. So I just wanted to touch on these for those of you who maybe weren't aware that these are going on. So we have 3 bills in total. The first one is focused on sustainable funding and support for CHWs. And working with partners, this bill ended up being somewhat of an evaluation bill. It looks at CHW payment mechanisms, the whole landscape of them, the rates that are assigned for reimbursement, and the technical support that is currently available for these for CHW payment mechanisms, and really tasks OHA with looking at all the available research out there on these payment mechanisms, identifying the gaps, and then putting a plan in place and making improvements to increase accessibility of these payment mechanisms. We recognize that those organizations who use community health workers really have to struggle to piece together the best reimbursement or Medicaid funding mechanisms for these. And so this bill will really allow us to identify those gaps more concretely and then come up with specific measures to address them. The second one on this list is something similar, but for mobile integrated health. Again, this is community paramedics or mobile integrated health professionals in Oregon. These individuals are not a recognized provider type in Oregon right now. So what this bill will do is create a registry and endorsement criteria for these professionals in Oregon, which will then open up particular Medicaid codes for reimbursement for these professionals who are on the registry. The bill also designates that technical assistance should be provided to both MIH providers in getting on the registry and for their organizations as they learn how to access these new billing mechanisms for this work. So this will be a really important step in trying to get some sustainable funding for the MIH work that's already going on in the state, as well as helping to support some new programs as they get stood up. And then lastly, this equity-centered career pathways in public health, this bill would provide $5 million to 3 organizations, CLO, the Oregon Mobile Integrated Health Coalition, and ORCHWA, Oregon Community Health Workers Association, to, again, continue a lot of the work that Healthy Rural Oregon has been doing in providing scholarships, barrier removal, and workforce development support for particular types of public health workers, those being community health workers, MIH providers, and local public health department staff. So these 3, like I said, are really important pieces that we're hoping to move forward as not only really good and important things for the state, but also as important sustainability pieces for at the end of this grant. Okay, that was my quick and dirty rundown on what we've been doing as part of Healthy Rural Oregon. I wanted to open it up to anybody else on the call who's been working with us and wants to share a little bit more about what their organizations have been doing. So I'm going to mute, and please feel free to jump in.
Madison, there's a question in the chat that's which legislators are sponsoring these bills? I'm curious also.
Oh, great question. So I'm going to actually go back. Nope. Can I go back?
I can jump in. You got it?
Oh, yeah. I just wanted to go back to the slide so you could see the ones. So the top 2 related to community health workers and mobile integrated health are going to be sponsored by Rep. Nose. We are not sure yet if both of these are going to be part of a larger package focused on coordinated care organizations and Medicaid billing. He's doing a lot of work in that space, and we actually work directly with him in putting some of these together. So more to come on whether those are individual or packaged pieces of legislation. And then the third one is co-sponsored by Senator Deb Patterson and Rep. Highfam. So be on the lookout for those this session.
Madison, if you're looking for more partner updates,
Yeah.
Sarah Anderson here from the Office of Rural Health. I wanted to let everyone know that we have launched, as part of the sustainability plan as well, a peer network for rural CHWs. We had our first meeting in November. The next one is coming up real soon. And it's a group of folks that we've trained through this grant and other folks throughout the state who are working as CHWs in rural, as a space for them to come together and talk about, resources, issues they've come up with, or come up against, so that we can help answer those questions or they can answer them as peers. And there's also a listserv that folks can be part of as well to discuss. There was a question that came up last week, or a couple of weeks ago, for example, around resources for Spanish language training, and that sort of thing. So I'm going to put the links for that group in the chat. If folks want to join, there's just a real simple form to fill out, and then they'll receive the uh, notifications or the calendar invites for the meetings going forward.
Thank you, Sarah. I was hoping you'd jump on and be able to talk about that this morning. So very well timed. And yeah, that resource has been awesome to stand up in the last couple weeks. So please share widely. We want to get as many people as possible involved in that group. So Casey, I think I saw you have your hand up.
Yeah, well, that's some amazing news that you're sharing this morning, Madison. So congratulations on all that good stuff. And I look forward to sharing stuff about the scholarships, especially with my network. So we received a grant from the Central Oregon Health Council, and part of that is going to allow us to hire 2 part-time contractors to further the work that we do here with the National Alliance for Mental Illness. So I'm going to be looking for someone to hire for that part-time position. It's going to be about 20 hours. It would probably be good for someone that has strong community networking skills and someone who's sort of like committed to mental health in the rural communities. So I'll drop my email in here. I'm putting a job description together, but just wanted to kind of drop that seed for y'all to be thinking of someone that might live in Madras, La Pine, or Prineville who would be good for that job. So yeah, excited to get someone in those rural communities furthering the work to improve mental health. So thank you.
Super exciting, Casey. And yeah, if you want to share that either job posting or job description once you have it, I'd be happy to put it out in one of our newsletters or do an email blast to folks that we know in that area.
Awesome. Thank you, Madison.
Yeah. Sarah Barron.
Hi, thanks. Exciting news on all the progress in the legislative bills. I have an update regarding Oregon Learns. Oregon Learns has been very successful, and we went past our licensed number of people for the learning management system. So I've been meeting with Echo from OHSU and University of Washington. They have something called PH LearnLink, which is this big HRSA grant, but we don't seem to fit in either of those areas very well, even though I tried to make a case for traditional health worker, continuing education. We kind of have a special area. So University of Washington did start to come up with some ideas of using something called Train. Have you all heard of Train? You have, Janessa. Anyway, Train is an open online self-paced training system that was established after 9/11 to create open education resources for the public health workforce. And so we are looking into using that open education resource. And the long story made short is I will be, once we move over into this open education resource, Oregon Learns, will go bigger. But right now, we're going to stay small. And if you're going there and you're trying to use it and you're struggling with it, it's because we've gotten too big. So we're looking for capacity. And if anyone has any other great ideas for learning management systems that are open access and something that we can move to, please reach out to me, because I'm still shopping around and trying to put a lot of minds to work on this, because having this will be very important for this workforce. This is something we don't have. The doctors in the kind of clinical side has it, but this is a kind of an unmet need for our community health side of it. So we definitely open to ideas. And that's it for my update.
Awesome. Thanks, Sarah. And yes, Jennifer, that's a great suggestion. I'm going to stop sharing my screen so we can see people a little bit better. Does anybody else have updates from their organization, things you've been working on in this space, questions about what we've been doing with the grant, or what others have? Jennifer, yeah, go for it.
Hey, good morning, everybody. Jennifer Little from Klamath County Public Health. Just a quick update. We are actively recruiting for our very first CHW. It's going to be a shared position of half tobacco prevention, half CHW, but we're just really excited to pilot this position. And if it's successful and this person is as busy as we think they might be, we'll probably make it a standalone position. So Madison and Janessa will be talking with you about sending this person to training so we can get in on it before the time is up. But yeah, we're really excited.
That's amazing. Yes, it's one of the goals of this project, but it's a special goal for me, is trying to get more CHWs embedded in local public health. It's such a good environment for CHWs. And it's a great way to boost that local public health workforce, which is always struggling to get people staffed. So I'm so excited for you, Jennifer. We would be happy to send them through trainings. So yeah, connect as soon as you're ready. Anybody else have updates, things to share? Cool. All right. Well, Sarah, I think you get an extra 5 minutes, which hopefully you're not mad about.
I'm not, because Madison asked me to cover a lot of topic areas, so I don't even know if 35 minutes will be enough. So let me share hopefully it allows me to share my screen. Let's see. Been having Zoom trouble lately. Let's see. Okay, cool. So we're going to talk a little bit about the landscape of the legislature today. Madison kind of asked me to do a legislature 101 and advocacy 101 for you all, and then to talk about close legislative agenda and see how you might get involved. So the first question I'm going to take off your plates right up front, and that is, what can I do as an advocate? I work in a nonprofit, or I work for an educational entity, or I work for a government entity. How can I get involved and advocate? And there are rules around it, but you can advocate more than you think. And basically, lobbying and advocacy is the same thing. Some nonprofits in the past have taken an education-only approach, and sometimes the state agencies have to take an education-only approach. And that means you can't say, please support legislative concept 2699. It just means you might educate folks on what the benefits of mobile integrated health are, or the benefits of community health workers. However, you can advocate more than you think you can. As a nonprofit, you absolutely can engage in issue advocacy. You can support or oppose ballot initiatives. You can meet with legislators about legislation. You can provide testimony and endorse legislation. you can absolutely ask them to support or oppose certain pieces of legislation. The only sort of two hitches, you need to use private funds to do that lobbying or advocacy work. And to maintain your tax exempt status, you have to put a 25% limit on how much time you or your employees are spending on that advocacy. Now, I will say lobbying is one of my main duties, and I am not restricted by this 25% because I am not a 501c3. I'm a 501c6. But even I don't spend 25% of my time actually lobbying. I spend a lot of time doing research and preparing to lobby. I spend a lot of time sitting in legislative committees, listening to the committee hearings and the topics that they're discussing. That is not lobbying. Lobbying is the direct conversations with legislators, asking them to support or oppose something. So 501c3s cannot endorse a political candidate or endorse or oppose a political candidate. As an organization, you can't make a contribution to a campaign, either monetary or in kind. And again, you can't use federal money, grant money to lobby or advocate. So you just have to keep an eye on those things. If you're a government entity like a local public health authority, or an educational entity, you can meet with legislators about legislation. You can support or oppose legislation. You can provide testimony, and you can use your general fund dollars as a county or an educational entity to do that lobbying. You cannot, however, spend any time or resources endorsing candidates or ballot measures. You stay out of elections completely. And you also cannot use any federal money to lobby. So you just have to keep an eye on how you are funded as an individual, how your position is funded, and then stay within those parameters on how much time and effort you're putting in. So with that, here's your Oregon Legislature 101. So we have 30 senators. They each have 4-year terms. And we have 60 representatives who have 2-year terms. So that means every single election, the entire House of Representatives is up for re-election. So this means they are constantly campaigning, especially as a representative. Senators can kind of take a little break after their re-election, and then, and then 2 years later, they'll start really campaigning hard again. We have a 2-year cycle for our legislature in Oregon. We have a long session coming up in 2025. It's an odd year. That means it'll be up to 160 days. And this is the long session is when they deal with state agency budgets. It's when really the bulk of the funding is considered and approved in Oregon. We have to have, as a state, a balanced budget that relies on revenue forecasting and a state economist who does that forecasting. And so, and really, until the taxes are collected in that odd year, so April 15th is when taxes are due. And then by early May, the legislature gets a report on how much money has been collected, and then they know what they can spend. On the even numbered years, we have short sessions. These are only up to 35 days. They usually start around February 1st and go through the first week of March. And it is very difficult to get anything meaningful done during short session because it is so fast. So usually it ends up being minor tweaks, minor budget adjustments, or legislation that almost passed during long session but just ran out of time. So short session tends to be a lot lower key for close specifically. And the long session is like my Super Bowl. There are in Salem 3 or 4 days a week, and that's my number one job is during legislative session from the end of January in 2025 through the end of June. That will be my main purpose in life. Before I leave, you all probably are aware that in Oregon, we have this really random thing called the kicker, which happens it's a convoluted thing that no other state has. It's in our state constitution, where the state economist has to predict within 2% what our revenue will be for the state. And if the economist is off by more than 2%, it triggers the personal kicker, which means any revenue over and above that 2% is returned to taxpayers. And while this might feel really great when you get a big check in the mail after paying your taxes, it makes the state legislature's job of solving Oregon's problems very difficult. Even when we have a good economy, we still end up being hamstrung by the kicker. So I've included some key terminology here. I'm not going to go over all this. I'll just try to remember to spell things out for you as we go, but I've included it as a reference point. So the legislature has lots of built-in deadlines to keep the process on track. And so everything is kind of mapped out in advance. This January 9th through 16th, the legislature will convene for what's called organizational days. This is when the new all the legislators, but the new legislators especially, come and they get their annual training. They kind of learn their way around. They get set up with HR. And then the session actually begins on January 21st this year, which is the day after MLK Junior Day. Then they'll launch into bills being heard in committee, and that in the first chamber. So just like when a Schoolhouse Rock, how a bill becomes a law, typically it has to go through two chambers, and it always starts in either the House or the Senate. So the internal deadline means that the policy bills have to leave the first chamber by April 9th to ensure that the second chamber has time to consider them as well. As I mentioned, taxes are collected April 15th. The final revenue report is given to the legislature and the public on May 14th. And then shortly thereafter, the second chamber deadline comes on May 23rd. And after May 23rd, the policy committees shut down. And that is when the legislature moves into budget mode. So from May 14th, when they get the revenue report, leadership really starts having meetings behind closed doors and in public, hearing different budget requests and considering those and making budget decisions. All has to be done by the end of June. The legislature tries to target an early sine die date and an early adjournment date, but really they have until the end of June to get that done constitutionally. So to understand the legislature, you really have to understand the hierarchy of power. In the Senate, the leader is the Senate president. Currently, that is Rob Wagner. In the House, we have House Speaker Julie Fahey. And then they really are the queen and the king of the legislature. They each appoint a co-chair for Ways and Means, which is the big budget decision makers. Those co-chairs currently are Representative Tana Sanchez and Senator Kate Lieber. They also appoint all the committee chairs and the committee rosters. So right now they are doing this Tetris game of figuring out which committees people are going to be on which committees, and then scheduling those committees so that the schedules don't conflict and that each member of each committee can make it to their committee assignment regularly. Underneath the big Ways and Means co-chairs are the Ways and Means subcommittee chairs, co-chairs. Those folks are, for Health and Human Services Subcommittee, it's Senator Campos and Representative Valderrama. They will hear the OHA budget, the public health budget, and they will have some input, but they get a lot of direction from the big Ways and Means co-chairs. They will be given a number that they can spend, and they will be given probably some broad parameters, and then they get to kind of fill in the details. Each committee has staff, legislative fiscal staff for the budget committee, And committee staff or LPRO, Legislative Policy and Research Office, are the committee staff. And then there's also Legislative Counsel, who are the lawyers that actually write the bill language, that when we request a bill or amendment, they write the language. So as I mentioned, I've mentioned most of these already. So I didn't touch on the Healthcare Committee chairs. Right now, Senator Patterson is the chair of the Senate Healthcare Committee, and Representative Rob Noce is the chair of the House Committee. Both those folks have been helpful on our legislation, and so we feel supported by them. We just wish they had power to make budget decisions. So this is going to seem very similar to your Schoolhouse Rock, how a bill becomes a law. There are two really types of bills. The first is a policy bill, and that's your basic Schoolhouse Rock, that a bill is introduced, it's filed in the Chamber of Origin. So if you're a senator, you file it in the Senate. It goes to the president for committee assignment, and then it goes to a committee for consideration. The chair has a lot of discretion as to when or if to hear that bill. They may get requested by another member or by the president to actually hear that bill, and then they will prioritize it. But let's say the bill does have a hearing and everything goes well, there's not a ton of opposition, maybe there's an amendment drafted, then the committee comes back for a work session. And that means the bill is ready to pass, you've got your amendment in hand, and in order to vote on the bill, to pass it out of committee, the legislature has to have paperwork in place, and that is the fiscal impact statement and the revenue impact statement. For a policy bill, we're going to assume that the fiscal impact statement is 0 and the revenue impact statement is 0 as well. It means it costs no money and it raises no revenue. For a bill like that, it's going to continue on to the chamber floor. So in this case, the Senate floor, where it will have a vote. And then if there's some controversy, which is pretty rare, it can be sent back to committee or reassigned to be worked on further until they have the votes. There's some strategery involved in that on the leadership's part to decide if it is going to continue moving forward or if it's too controversial to pass. So then it moves to the second chamber and the whole process starts again until it's voted off the House floor, and then from there it goes to the governor for signature, where she does have the ability to veto things just like the president would. If a bill costs money, it has a fiscal impact statement. And most bills honestly do cost money because if you're directing an agency to do new work, it's going to cost them time or staff time or some other fiscal cost. And so in the committee work session, the fiscal impact statement says it's going to cost $500,000 to implement this bill. Then that creates a different path for the bill. So then it goes to a subsequent referral to Ways and Means, where once it has that fiscal impact attached to it, it will sit there in Ways and Means waiting for action until after that May revenue forecast, because the legislature doesn't know how much money they have to spend until then. And so it just goes to Ways and Means and it sits. If it is assigned to a subcommittee, that's a good indication that it's going to move forward. If it's not ever assigned, that's an indication it's not moving forward. So there is something that one needs to do in order to convince the co-chairs of Ways and Means that it needs to be assigned to a subcommittee. If it does get assigned, that means the legislature, the leadership of the legislature has kind of signed off on it and said, okay, yes, we're willing to move forward with this, this bill and this initiative. So then it goes to a subcommittee work session, which is a vote. And then it goes to full Ways and Means for another vote. and then it goes to the originating chamber floor. And then once it's voted and passed there, it goes to the other chamber floor. So in this scenario, you skip the second chamber, sort of. You don't go through the policy committee in the second chamber. Instead, Ways and Means is a joint committee, so it has representatives from both the House and the Senate. So that's the thinking, is that it can bypass the second chamber for that reason. I'll pause there and see if folks have any questions before I move on. Okay, hearing none. CLO has a very ambitious agenda for this legislative session. We have 4 funding requests totaling $65.2 million. The first is our usual request, which is furthering public health modernization. We have a request around funding addiction primary prevention for public health and tribes. We have an early childhood request around women, infants, and children program and nurse home visiting. And we also have the workforce incentives bill that Madison already told you about as well. And I'll go into each one of these in a little bit more detail. We are really trying to frame our requests around the governor's priorities and the legislature's priorities, which are housing and behavioral health. And my argument is really that you can invest in someone's housing and behavioral health, but if they're dying of a communicable disease, the efforts are going to be largely lost, right? You have to also consider the physical health of someone, the whole health of a person, in order for these investments to be successful and to have good outcomes. So when someone has a lack of housing and they're using substance use, they have an increased risk for communicable diseases for a couple of reasons. One, if they're living in congregate settings like shelters or even tent cities, they're living in close quarters. And we know from COVID, that's how some communicable diseases are transmitted, right? Tuberculosis, for example, or COVID, or other diseases that are more airborne like that. We also know that if people are using substances, they are not necessarily making great decisions about their health. They may be having unprotected sex, and sexually transmitted diseases are running rampant right now. And we have a resurgence of congenital syphilis as well, which is when mom passes the disease to the baby. We also, because of substance use, people sometimes will end up sharing needles or dirty needles, and that is how diseases like hepatitis C are largely transmitted. So we know that we need to do more proactive public health outreach, testing, and treatment. And we need to do a lot more prevention work in partnership with homeless serving organizations through public health modernization. So we have a defensive game with our communicable disease work. We really need to move into the offensive game, and we need more resources to do that. We also know that substance use disorders and mental health challenges are costly, but they're also preventable. So we are asking for $25 million to go toward addiction primary prevention efforts for local public health and tribes, so that we can start working with young people in a more robust way than we have been able to thus far, to really, get to the root of this problem and prevent addictions and mental health issues from occurring in the first place. And that way, 10 years from now, we're not in the same crisis position. Along those similar lines, early childhood supports like nurse home visiting and WIC are also primary prevention efforts. They allow moms and young children to have better nutrition, better educational outcomes, better parent-family bonding. They give skills to the parents, which when parents have those skills, they do better, and there's less involvement in the child welfare system. The outcomes are immense. And these programs also identify risks and needs of the families and refer them to further services like substance use screening and treatment. So public health is really the front line and the front door for a lot of other preventative or early intervention services. And of course, the foundation of all these things is workforce. We can't do it without the workforce. So I kind of already touched on the communicable disease stuff, and I know it's not the direct focus of this group, so I'm going to move on. And I've already talked a little bit about primary prevention, but this request of $25 million would allow every county in Oregon to hire at least one full-time prevention specialist and develop evidence-based school or community prevention programs. It would also allow us to increase collaboration with community or culturally specific organizations as needed. WIC and nurse home visiting, again, prevention programs. We just know that we have way more need than we are able to accommodate. And so if we had a little bit extra investment in these programs, we could reach more families, we could do more good, we could do more prevention. So here is the equity-centered career pathways in public health for $5 million. As Madison mentioned, this would cover scholarships, training costs, stipends, the same work that the Healthy Rural Oregon Project has been doing, but it would extend it. And it would also share the workload with the Community Health Workers Association and with the Oregon Mobile Integrated Health Coalition. It would provide $1.5 million for the community health worker piece, $1.5 million for the community paramedic piece, and then $2 million for CLO for local public health. Largely, our pot is a little bit bigger, largely because our education is quite a bit more expensive than the other two components. And I love using Jessica Mendoza as our star example because she works for Jefferson County Public Health, and she's just such a shining star. So she works for Jefferson County Public Health. She started as a receptionist, and this grant really allowed her to become a community health worker. She then went on to get her healthcare interpreter certification, her medical assistant, and is also a notary, I think. So she's just like layering on the certifications and is really a great example of what this grant has done. And in my mind, under the CLO funding, if Jessica was like, I love this work so much, I want to continue advancing, I want to get my nursing degree, I would love for CLO's $2 million to help support her to get her RN or whatever next level certification she wants to get to continue advancing in her career in public health. So that's the vision there. And we do have some policy things we're supporting as well. So, you know, public health is really big on quitting smoking and quitting vaping. And so this is a second session that we will be helping to support the tobacco flavor ban legislation. We are not leading this effort, but we are supporting the coalition's effort to do this. Rep. Sanchez will be putting forward a new tax, a point of sale tax on beer, wine, and cider. We have one of the absolute lowest tax rates on these products in the nation. They have not been raised in over 40 years. And if we were successful in raising these taxes, they could help pay for our addiction primary prevention initiative, as well as youth treatment and recovery, which we know Oregon is severely lacking in. There may be an effort to start the discussion around how to reform how we fund vaccines in the state. Right now, the federal government provides most of the funding. It's inadequate, it's overly complicated, and especially with the new director of, is it HHS or CDC, whatever RFK is, I think it's probably going to be in further jeopardy over the next 4 years. So we really need to figure out how to sustain those services. And then we have 4 CCO reform bills, 2 of which you guys don't care about, just adding public health or local government to CCO governing boards. And then the other 2 Madison already mentioned, the increasing billing pathways for community health workers, and then the same for mobile integrated health. And That's it. I did it in under my time. So I do want to just flag for folks, if you want to learn more about the topics that I talked about today in depth, I do have a whole training series on the CLO website. We did a 5-part Lunch and Learn series that I tried to make evergreen so that it would be relevant for multiple years. And you can learn more about Oregon Legislature 101, how to read a bill, how to track a bill through the OLIS system online, how to testify and write a letter to the editor, and really more details about how to be an effective lobbyist. With that, I'm happy to take your question, Casey.
That was so informative. Honestly, that was so fantastic. Thank you so much. You really broke that down so well. I do have a question. Like, what about those of us who maybe, aren't ready to take it to that level yet, but maybe we want to get involved in like our local governments, our county governments? Is that something you have expertise with, that you could do like a future session on, or any guidance for those of us who maybe want to start a little bit more locally first before we took it up a notch?
Yeah, and I'm gonna give you a couple of things, and then I'm gonna ask Jennifer Little to pipe up, because she and I often do this dog and pony show together. So yes, you can get involved in your local county government. Your county board meets probably 1 to 2 times a week. They will post their agendas online. You can keep an eye on what they're talking about. They often, and I think by law, have to offer a public comment period. So there is that opportunity. You can also set up times to meet with your county Board of Commissioners as individuals to talk about certain issues. Maybe you want to work on, the idea that comes to mind is more regulation around tobacco and access to tobacco for kids. Jennifer in Klamath County has done amazing work with her county board on doing this. And I think Klamath probably has the strongest regulations now in the entire state. So whatever your topic is, reach out to your county commissioners and set up meetings and lobby them just like you would the state legislature. Jennifer, do you have anything to add? Maybe she left. Did she leave?
Yeah, I don't actually see her on here anymore, but
she's like, I've heard all this 17 times before. I don't need to stick around for this part. Casey, did that cover it for you?
It did. Yeah, I think I'll start by maybe just setting up time to get with the county commissioners. I don't want to come in gun blazing at first. Like, I'd kind of like to get the lay of the land. At the same time, like, time is so limited. I don't have time to like develop relationships and go to all the, different things. But I think I will start with, meeting with our commissioners and take it from there. So thank you.
Yeah, great. And yeah, that's a good point. You don't have to have an agenda. You can just say, I work in mental health and here's what we're working on. I would love to be a resource to you as you tackle these issues in our community, and you can just start to build a relationship that way.
Yeah, I think I'll do that. Thanks.
Yeah. Angie.
Hi, can you hear me?
Yes.
Oh, good. That means I've had my sound on the whole time. That's sad. I'm sorry if I was annoying to anybody. I was curious. We are based in Multnomah County, but we're working really hard to support and engage with parents in other counties. Can you show up to different counties? What was just described? Like, can you show up just to county meetings to just what? I'm sorry.
Yeah, I mean, the short answer is yes, of course you can. I think you want to be strategic about how, how you show up, because the priorities are going to be for the residents that live in that county. But if you're doing work in another county, and, you express that and say, we are partnering with these organizations and we're working in your county to do this type of work, and here's what we're experiencing. I think they'll be receptive to that, because if you're trying to help them solve their problems in their county, they'll be open to hearing from you as well. So yeah,
Yes. Thank you. And I should have clarified. That was my intent, was to be supportive and to advocate for the residents that are in that county in regards to the work that we do specifically, to be able to share, these are the things we know, and this is what would be, great to see represented or available to parents. I should have specified that was my intent to begin with. Thank you.
yeah, absolutely. Any other questions? So I know you all have full-time day jobs that it does not usually include lobbying the legislature. So I know, or your county government. So I know that you don't have a ton of time to do this work. However, if you are interested in helping to advocate for the HRO work, our workforce incentive bill, or the 2 policy bills that Madison told you about, please let her know. We love to have testimony from all over the state, if possible, about how this has positively impacted your community or your workforce, and just creating that that momentum and around why we want to keep this going and why it's so important. I will say too, the advantage of this legislation is that we would be able to serve the entire state and not just rural Oregon, although we've almost served the entire state under the Healthy Rural Oregon grant, all but 2 counties, I think. So we're almost there, but the legislation would also help us bring in those other 2 urban counties as well. So there's something for everyone to gain.
Sarah, this was awesome. Thank you so much for taking some time to walk us through this and really talk about how we can continue to be engaged in this legislative session. As Sarah mentioned, if you want to know more about this or talk with us about how we're engaging, please reach out to us. We're happy to bundle some people together to do testimony together or letters of support or other things like that. So with that, we are right at time. So after the call, I will send out a link to the recording of the meeting as well as our minutes. And then, of course, you have our contact information if you have other questions or things that come up. We will likely do 1 or 2 more of calls like this before the end of our grant period. We're hoping to do kind of like a grant wrap up call or meeting, potentially even in person somewhere in Central Oregon, sometime later this spring or early summer. So keep an eye out for those invites. And of course, if there's things you'd like us to talk about or include in calls like this, please let us know. So thanks again for joining us today, and we'll be in touch with more information soon. Thanks, y'all.